the door-to-door contacts you've been having, I mean, we're hearing reports that people are just not answering the door to politicians. Has that been your experience?
No, not necessarily. I think people's passions have changed. I suppose a lot of people working from home now. Someone ringing a doorbell in the middle of the day, you might get someone at home, but that person might be upstairs on an important work call. So the flows and where you find the electorate, I suppose, has somewhat changed. I'm finding people engaged. I hear a lot of kind of media commentary that it's been a dull campaign or whatever else. What I'm actually finding is for the electorate, it's been a difficult campaign. And I'm being really quite honest in relation to this. I'm meeting people, people who maybe aren't sure who to vote for. There might even be people listening to this program today not 100% sure. And people are teasing through the issues. So, on housing, wanting to say, show me, tell me, give me a bit more detail. What hope have you got for my children in the next 5 years? Explain to me how you're going to afford to do what you're committing to do. And asking quite a lot of detailed questions. And I've definitely noticed in the last week, 10 days of the campaign, people becoming very engaged on the issues. And I think that's what's really brought us to this point of having a very close election tomorrow. But it is always winter campaigns, dark nights. It is always harder, I suppose, to find the
Were you
electorate.
shaken by the Kanturk encounter?
I was annoyed with myself. Because
No, but
I
did
betted
you
that.
kind of...
Look, I messed up, and I messed up on an issue that is extraordinarily important to me and my family. The issue of disability is there isn't a more important issue based on my lived experience, and I knew I messed up. But you know what? I was reared, Pat, that when you make a mistake, you put your hands up, you apologise, and I hope the good thing that's
It's
come out of
not
this
it's
is
not
that we've
common
now had a
in
real
politics
focus on
that
these
people
issues.
say they're wrong.
No.
But at the same time, it can, you say you're wrong, and it may lead to a sense of vulnerability that people will seize upon.
Well, look, my political opponents can seize on whatever they like. I think the people of Ireland, I certainly hope, know me. I think they know me for the leadership I provided through the COVID pandemic. I think they've seen the role that I played as Taoiseach. I hope they know how hard I work. And I think a lot of them know my own story in terms of personally getting involved because of the lived experience that I have in my own family with my brother having autism. I think people want to see when you hit a vulnerable patch, when you make a mistake, when you err, how you respond to that. And I've tried to respond honestly, no spin, no whataboutery, no justification, just saying that was my mess up. I own it. I'm sorry.
Now, we'll move on to housing. You talk about housing and people asking you, are my kids going to be able to afford to buy a house or even rent a dwelling of some kind? When you look at the stats, I mean, rents have gone up from 2011, 825 was the measure per month. Third quarter of 2024, 1,955, more than doubling in that 13-year period. You can look at the same house prices. In 2011, 212 would buy that typical three-bed semi. In the third quarter of 2024, 344,000, gone up by, 67% or whatever. Why would people believe you that you can contain this housing crisis?
Very fair question. But I think the reason I'm asking people to believe us and vote for Fine Gael tomorrow is because the people of Ireland understand that the last 14 years haven't been static. They understand that in many ways Fine Gael's time in office has been dogged by a number of major issues that had to be addressed. The IMF bailout, the crash, no construction sector, no banking sector, that was the first part. Then Brexit, then COVID, then an inflationary crisis. And against that backdrop, we've gone from a situation of building fewer than 7,000 homes a year to up towards 40,000 this year. And now, crucially, Fine Gael has something that rarely this country has, money and a plan at the same time. We have a €40 billion plan to deliver 303,000 new homes. And you know what, you asked a very direct question there. You read out the headline figures, as you quite rightly should, they're factual. But people around the country know that those headline figures aren't the reality for everybody now, because we have a Help to Buy scheme where 50,000 young people so far have benefited from getting 30,000 off that towards the cost of the house. We have a First Home scheme where we take a share in the house as well. So there are supports in place.
Okay,
that
but
we
the London
must keep
School of
in place.
Economics, looking at the experience of those kind of schemes in the UK, said that they stoke inflation
Sure.
in house prices.
And I don't profess that these schemes are perfect, but I would say two things. When the Central Bank of Ireland looked at it in the Irish context, they found that now would be the wrong time to remove these supports. The second thing is, even if there is a small inflationary element, and that hasn't been proven, but even if there is, the scale of the intervention in terms of assisting the first-time buyer exceeds that.
Yeah.
What we have to do is bridge the gap from here to proper supply. And I can't say to a first-time buyer living in the box room of their mum or dad's house, come back to us in 5 years when we have enough homes to lower the prices. We have to help them in the here and now. And that's why we're unapologetic in keeping in place these first-time buyer schemes.
The box room dweller is one of the cliches of the selection, I have to say. And I don't know anyone with a box room. A small bedroom, perhaps, but a
Okay,
box room.
let's call it that. But I think you take the point.
Yeah, yeah.
It's the young person living at home who no longer feels that young, who doesn't want to be sitting down in the
Sure.
sitting room with their parents every
I
evening.
understand that. I mean, it's
That's what.
awkward for everybody,
Yes,
particularly trying to maybe have a romantic life as well
and
in the company of your parents. Not easy. The question of help to buy and those other schemes. In my experience over the years, looking at the various schemes that governments have introduced, like Section 23 and Section 27, they might work at the beginning and then the builders take it all. They always take advantage of state incentives and the prices go up and it goes into the builder's back pocket.
well, that's why I suppose in many ways we've resisted doing some things that people have asked us to do. So we haven't extended the price level to which you can use the Help to Buy scheme. And we've been asked to do it, but we haven't because that would have a very significant inflationary cost on house prices. We're also putting a time limit on this. These are schemes that will be in place for 5 years and then will go. But what we're doing with that period of time is getting the number of houses up from nearly 40,000 now to 60 and keeping it at that. Because if we can, and we've lots of expert advice on this, if we can get to 60,000 homes a year and keep it there, we will fix the housing crisis. What we won't do, though, is if we have a situation now where people pull the rug from the first time buyers, you'll make life harder for young people in this country, and we can't do that.
Now, moving on to health, can you fix the health service? I mean, we know that once you're through the gates that you tend to get very good care, but there are people waiting a long time even for cancer treatments, which you'd think that's the one area. I think Michael Noonan made cancer his priority. You'd think that was sorted, but it's not sorted. So the HSE was started in what, 2005? We still don't have 7-day working weeks in the HSE. After all that time, more and more money, billions pumped in every year, and we don't seem to be getting the result. We put the money in, we don't get the product.
So two things I'd say on that. Firstly, and you, in fairness, you've acknowledged it, there are signs of progress in lots of parts of health. So survival rates for many illnesses have gone up. Life expectancy in Ireland is higher than the EU average. Waiting times are still too long, but they are falling. They've fallen for
A&E, 10 hours, 12 hours.
But just to make the point, they are falling, and they have fallen for the last 2 years when they've risen in Northern Ireland, risen in England, risen in Scotland, risen in Wales, and risen in most of Europe. But I think your point about reform is the key here. I've been a health minister. This idea of having to argue with the Department of Finance every year over the budget doesn't create a conducive environment for reform. That's why Fine Gael are proposing, and I've been adamant about this as Taoiseach. That's why if we're re-elected to government tomorrow, we will provide the health service with a multi-annual budget for 5 years, clarity on their funding. Now, why does that matter? It matters because it empowers the people running the health service to plan beyond winter to winter. It allows them with certainty know how many nurses, how many doctors. It allows them have the reform conversation around the GP contract, the pharmacy contract. I think that's a key enabler, and we've seen in other countries where they reformed their health service that multi-annual certainty of funding is absolutely key,
Now,
and that's what we're going to do.
You have a recruitment section in your manifesto which suggests the recruitment of all sorts of people, and we badly need them. There's no costing of that, and Micheál Martin had to go to slightly during the debate about that, but he was right, there is no costing. And then you said that it's to be funded from within the allocation. But if you do that, where do you save the money from that goes? If you're going to take it from an existing allocation, what suffers because you're using that money to pay for new staff?
No, I suppose I gently had to go back at him because I think, and I'm sure this was an error rather than an attempt to misinform. But the reality is, we've set aside over 17.2 billion euro through what they call existing level of service plus a contingency fund, and that will allow us have the level of additional recruitment into the health service roughly the same as what we've had over the last number of years. But I've got to be honest with your listeners, because your point is right. We've increased the number of people working in the health service by about 27,000. These people are all working hard. We've an ability to do about the same again. But I'm being truthful, I'm being honest. If the conversation is just about numbers and just about budget, it won't bring about the reform. That's why we have to have a new GP contract. It's why we have to support and resource our pharmacists. It's why we have to change the delivery of our therapy services.
But people say, why didn't you do it? You were in power, why didn't you do it?
Well, it's very simple. In politics, your in-tray, it's not like a job where you go in, you clear the in-tray and you say, job done, Pat. Every day in politics there's challenges, and every day you've got to respond. So much of the last number of years has been dominated by, from a health point of view, responding to COVID and then rebuilding after COVID. And we have, despite that, seen waiting times fall, trolley waits fall, and seen very significant increases in clinical outcomes for our patients.
That trolley weight fall has only dropped, I think, in latter times. I mean, it's been quite high for the bulk of your 5 years.
It has, and as we put in the additional capacity and we've committing to 5,000 more beds, we are beginning to see the benefit of that. So hospitals, give you one example, the hospital in Waterford, which used to have very high trolley numbers, has now seen dramatic improvements. And that's a combination of reform, additional budget, additional staff and additional beds.
Now, you mentioned you were Health Minister, and you were the one who brought the contract for the National Children's Hospital to Cabinet, and it was signed off by the Cabinet. That's collective responsibility. But in your capacity as Minister, you must have thrown your eyes over the contract and look at the mess the contract has produced financially.
So I think there are very significant learnings from the Children's Hospital, and that's why, of course, I didn't just do what you said there. As Minister for Health, I also commissioned PwC to independently review the entire situation, and they reported, and that report was published, and they said that to do anything else at that stage would have resulted in the hospital taking longer.
In for a penny, in for a pound.
Taking longer and costing more. I think the bigger question here is this. Why did we go through the entire Celtic Tiger and no one invested in a new children's hospital? We needed this children's hospital. There's people listening to this
that's a
programme
bit disingenuous because, I mean, there was talk of a children's hospital for 20 years prior. And we had the site up at the Mater Hospital, which was kiboshed. It was a lunatic idea, but there you go. We then moved to St. James Hospital, which is the wrong place. I mean, the whole philosophy behind this was tri-location. Where's the maternity hospital? Your predecessor, Leah Radker, told me that the planning permission for both would go in at the same time. It didn't happen, and now there is no room for a maternity hospital.
So in many ways, you're making the same point as I'm making, that there was talk about a new National Children's Hospital for many, many years and nobody built one. And there's parents listening to this programme tonight who slept on coal floors in Crumlin and in Temple Street. There are people, nurses and doctors, doing incredible work in those hospitals in inadequate conditions. So many of the issues that we get asked about in terms of children's waiting times for paediatric surgeries and the likes is as a result of an inadequate number of theatres. So this is an expensive hospital. It is a hospital that costs more than it should, but it will be a revolution in children's healthcare. And can I just say this? There are 3 parts to this hospital. There's a satellite centre in Tala, a satellite centre in Connolly, and the main hospital.
But the vast work is going to be done in St. James, and it's not open yet.
80,000 children have been seen through the 2 parts that are open. There are children getting treatment today. So this hospital is expensive, but it is an investment in children's healthcare. There's a broader point you're making, though, about the delivery of infrastructure.
The tri-location, first of all. So it hasn't happened.
So on tri-location, it is still the national maternity strategy to tri-locate to locate maternity hospitals and co-locate them with adult hospitals.
But no room in James.
That is still the intention.
The traffic problems that are going to ensue.
And I believe there is still room there, but there's a broader issue in relation to the delivery of infrastructure. Some politicians, in fact most, are running in this election on that let's continue as we are in terms of the delivery of infrastructure. I'm the only leader proposing establishing a new Department of Infrastructure, because I can tell you this, we live in a small country, 5.3 million of us in this jurisdiction, and every time we go to deliver mega infrastructure projects, we seem to hit challenges. We need to bring in engineers, project managers, quantity surveyors, and if I'm back as Taoiseach after this election, it'll be a red line issue for me that we establish a Department of Infrastructure to bring in that expertise.
And that's
I think it's really important.
A very good idea. I mean, I've been critical all the time that we build the apartments and then we say, where's the shop?
Exactly, we need expertise.
In Spain and Portugal, where I've seen it, they build the shop first and even put up the street lighting before anything else happens. Now, the other hospital that's going to be built is the new National Maternity Hospital on the site of St. Vincent's Hospital in Leafy, Dublin 4. Why there? Because there's not exactly a baby boom in Dublin 4. It's not where the babies are being born. They're being born in West Dublin, by and large, in that ring around the city, in the suburbs. Why put it in a place where it's very expensive for staff to attempt to live, to rent or buy? Is it because it suits the consultants? They like the leafy suburbs of Dublin 4.
No, it's genuinely because it makes sense to co-locate the hospital there from a medical point of view. It makes sense because so many of if a woman gets very sick in Holles Street today, and that can still happen, that woman is automatically transferred to St. Vincent's Hospital in so many cases. And the length of time that it takes to transfer the woman from the Holles Street to Vincent's can be the difference between a good and a bad outcome. So the co-location of the National Maternity Hospital makes it.
It's Dublin 4, as I say, no baby boom there.
Because it's not the only. We're planning on co-locating all of our maternity hospitals. We're planning on moving away from this standalone approach to maternity hospitals, because thankfully for most people when they go into a maternity hospital it's a time of great joy, but for a time when things go wrong we do need to co-locate. And of course we're also relocating other maternity hospitals, including the one in Limerick, for example.
Now when you're knocking on the doors, you hear about housing, you hear about health, you also hear about childcare. And a lot of the schemes that all the parties are putting forward are about reducing the cost to the parent. But when you look at what a graduate might earn going into childcare, $15.50 an hour. I mean, it's not a very enticing salary. So How is that problem to be resolved?
No, you're actually right, because so much of the focus in this election debate has been about reducing the cost of childcare. And my party will reduce the cost of childcare to €200 per month per child, and we do it in the next budget. But just let me say but, because that is the easy bit. That will cost about €194 million over the lifetime of the next government. The harder bit is actually the bigger spending plan we have for childcare in our manifesto, which is to both create new places and new staffing levels. And that's going to involve, firstly, many multiples of that amount of money to reduce the cost. Secondly, it's going to involve agreeing a proper pay structure and career structure for people working in childcare.
Now, that means you agree this because there will be state childcare as well. We're told that's
Correct.
part of your
Yes, it is.
vision. It means that there'll have to be parity of pay between the two sectors. So you're telling the private operators you're going to have to jack up your pay and conditions to meet what the civil service effectively childcare workers will get.
There will have to be pay parity, of that there's no doubt, but we're not saying to the private provider that you have to pay for it. We're saying the state will work with you and subvent you in relation to that. This is, for me, this isn't an investment in childcare providers or in public childcare, it's an investment in children. And what we need to do is empower parents, in the first place, to be able to access a place, in the second place, to have choice in relation to the provider they choose. Some parties are proposing all public, getting rid of private. I don't believe in that. I believe in a parent's choice. Many private providers do a good job. But even with supporting private providers more, there's still going to be a need for the state to intervene and provide public facilities. So Fine Gael in government will create 30,000 more childcare places. We will open 100 publicly run childcare facilities, and we will map out in the first 100 days in governments where they should be. And you might say, you'll only map it out now. That work has actually started in the Department of Children. Where in Ireland is the need most acute for public intervention in childcare?
Okay, where are these recruits going to come from? I mean, and where are they going to live? Because the big demand for childcare is obviously in the Conurbations.
But they live in Ireland. I mean,
No,
but I don't mean that smartly. But I've
where are
knocked
they going to live when they're living close, hopefully close enough to the places where they work, which will have to be in the Conurbations.
But Pat, the amount of doors I've knocked on where there are people who would like to be working more, where people who are working part-time would like to work full-time, where people maybe have decided they need to stay at home and care for their child but would like to work but can't because of childcare costs. There are opportunities in terms of underemployment in the Irish economy. There are lots of people being forced to make decisions due to a lack of childcare. And what I'm saying is, as we improve childcare, we'll actually open up more opportunities for people to enter the workforce.